COVID cases are up and events are being canceled left and right. The latest wave of cases has already caused panic, but with the Omicron symptoms being described as the common cold, should we even really need to be worried? Now, joining us now to discuss more on that and other recent COVID news, internist at Northern Westchester Hospital, Dr. Frank Concesta. Welcome, doctor. It's good to have you.
Good morning. Thanks for having me.
Dr. Frank, let's just get right into it. Yesterday it was reported that the White House is prepared for the rising cases. And President Biden, we're preparing to have him give a speech on Tuesday regarding this. Now, what do you think we can expect coming out of that speech?
Well, I think you can expect that they're going to try to shut things down again. We're seeing that here in New York. They're using the Omicron surge as an excuse to shut down schools, to close Broadway shows. And I don't think that is going to really be very useful going forward, because the Omicron, as you said before, the Omicron virus has shown to be fairly mild, and it's going to turn into basically the flu. So I think we have to try to get used to having this as part of our lives and move on and get used to it, because it's going to become endemic. We have to move past the pandemic and move into an endemic situation.
Right. I think that you brought up a good point. I was out and about yesterday, and a number of restaurants that I eat in all the time were closed down with signs on the windows saying, closed for COVID. But New York has reported that positive COVID-19 cases in the state jumped 154% in less than a week. Now, that's about 82% of the population having at least one vaccine dose. So I'm wondering, what are your thoughts on these cases with it spreading, even with having so many people vaccinated?
Well, cases are definitely up. I can tell you, even just, in my own office, I've gone from, maybe 1 or 2 cases a week to, I had 5 or 6 yesterday. But the deaths and hospitalizations are not up. I was actually on CDC this morning just looking at the data. And if you look at the line, it's fairly stable for deaths. Cases are skyrocketing. But you can see the same data with the flu. As the flu cases skyrocket, and we're seeing the same thing right now. I'm seeing just as much flu as COVID right now. And, we're going to have to just get used to it.
Right. Do you think that that means that we're in a transition period right now, that Omicron is that transition period where COVID does become endemic?
Yeah, absolutely. Viruses get milder as they evolve. And then that's just the way that things go as far as evolution. And we're going to start to see that. We can't really shut down our lives anymore. It's time. We have the holidays coming up. It's time to get together with families. It's time to get together with your friends. We have to move on.
Right. I mean, at this point,
there's no reason to panic.
We've been in this for about 2 years. Now we have this Omicron variant. We have the vaccine. Do you think that this new variant is an opportunity for us to be able to reach herd immunity?
Herd immunity is coming. Omicron will be the best thing that ever happened. You have a mild strain that's very transmissible. It should make its way through the population, conferring herd immunity to a large number of people. And yes, this is our way forward. And you keep mentioning the vaccine. The vaccines are important. The vaccines are very important. But what we've seen is sort of a single note symphony from the government and from the governor and from here in New York. The vaccines are important, but we have to have early testing and we have to have early treatment. We are using the monoclonal antibodies, and I'm actually having trouble getting treatment for my patients because of the surge in cases. We need to have more resources for early testing and early treatment. And we have to move past the idea that the vaccine is the only way forward. Vaccines are important, and I echo that message constantly. But we have to have other options as well.
I guess kind of expand more on some of those other options you were talking about, early detection, testing. What does the public need to know in order to keep kind of making that a reality and helping to fight this virus with using those measures?
Well, as far as early testing goes, and I've mentioned this before, that in my office I have a machine that I can do a PCR test in 45 minutes.
Wow.
And what that allows me to do is to determine whether somebody has the flu or somebody has COVID. And if they have COVID, they can isolate and they can not see 30 other people before they realize that they have COVID. A lot of times people go to urgent care and they might not get the results for 3 or 4 days. That's just unacceptable. What good is the information 3 or 4 days from now?
Right.
We need to know right now. So if we can put resources towards things like early testing, that will help us control things.
Exactly. Right. Well, thank you so much for all of the work that you're doing, Dr. Frank, and thanks for being on with us this morning. I appreciate it.
Thanks so much for having me.